Hello, my name is Dr. Rusty, and welcome to our very first episode of Think About It. I am super excited to talk to you all today about the fuck kind of drugs our second graders are on. Now, I'm not saying Johnny is going to school with dime bags of some nice blue crystal meth, but that doesn't mean Johnny isn't going to school without methamphetamine at all. Adderall and Desoxyn are two drugs that belong to a class of medications known as central nervous system stimulants, or CNSs. CNSs are commonly used to treat a condition known as attention deficit hyperactive disorder, or ADHD. While CNSs are one treatment option, there are many well-known ADHD medications out there. Ritalin, Vyvanse, Concerta, Ditrana, Focalin XR, but we're not going to worry about those ones today. Amphetamine was first discovered by scientists Larger and Dale in 1910. However, it was not synthesized until 1927 by chemist G.A. Alice. Now, I know most of the people watching the show probably have ADHD, or at least self-proclaim that they do, so try to hang in there for like 5 more minutes, because I promise you're going to find out some cool stuff, you meth heads. Amphetamine was discovered to be a better substitute for a drug called ephedrine, which later peaked in the 1950s as the primary drug for treating asthma, even though it was a major source for producing the addictive compound methamphetamine, i.e. crystal meth. Once synthesized, the first amphetamine marketed in the US was Benzedrine. Studies in the 1930s, back when they could do whatever the fuck they wanted in medical studies, including do secret ones, did show effective medical treatment for children with ADHD, but it was also believed to enhance cognitive abilities, tempting academics, students, and medical professionals alike to take it so that they could become more, intelligent. However, the best factoid we came across was that during World War II, Benzedrine was known as energy tablets. So while dismissing the largely addictive potential for amphetamine, soldiers would be given these pills in order to stimulate their senses. Amphetamine was even prescribed as a weight loss pill in the 1960s for housewives. I know. Perfect time to cue a misogynistic joke here, but not the perfect time to get canceled on episode 1. Adrenal was introduced in 1996 by Richwood Pharmaceuticals, which later merged with Shire Pharmaceuticals. The DEA has it as a Schedule II substance, one that designates it as having an accepted medical use, but still contains a high potential for abuse and dependence, which could lead to addiction. I mean, Desoxyn has to be better, right? Well, Desoxyn is a legally prescribed ADHD medication, and it contains methamphetamine. Desoxyn was discovered back in 1942 by Abbott Laboratories. However, it is currently manufactured and distributed by Ovation Pharmaceuticals in the US, which is owned by Dutch Pharmaceuticals. It's a company in Lundbeck, which is located where? Copenhagen? Where they have their own self-governing drug-dealing district? That seems kind of ironic. While they both target the central nervous system, Adderall comes in both an immediate release tablet and an extended capsule, while Desoxyn only has the option for immediate release. Desoxyn contains methamphetamine, which is converted to amphetamine in the body. Adderall is a mixture of both amphetamine and dextroamphetamine salts. Desoxyn is only recommended for those above the age of 6 years of age, while Adderall users can be as young as 3 years old. How do you even get a proper ADHD diagnosis at 3 years old? And even if you have one, what schoolwork are you fucking working on that you need to pop some CNSs? I mean, are you just trying to introduce them to addiction early? Because if that's the case, then I respect it. In addition to ADHD, Adderall is also a treatment for narcolepsy, and Desoxyn is also used for some eating disorders in order to suppress appetite, because you gotta get that fine-ass meth bod somehow.
Adderall is far more prevalent of a treatment, as the long-term use of Desoxyn has been linked to pulmonary arterial hypertension. Therefore, many prescribers avoid prescribing it or use extra caution before giving it to a patient. Desoxyn can also be significantly more costly, which makes sense because it's probably far less produced off the streets.
Desoxyn, 30 milligram pill. The typical dose of crystal meth is called a point, which means 0.1 grams of the base. Don't ask me how I know that. This smoked dose is more than triple the dose taken orally and crosses what we call the blood-brain barrier much quicker due to the method of administration. This means that it gets absorbed into your body through your lungs at a much faster rate than in your digestive system, where you're essentially flooding receptors when you inhale smoke versus slowly introducing the molecule to binding points in the body when swallowed. I also warn you that it only takes tolerance, when the body gets used to a medication so that more medicine is needed for the same desired effect, 5 to 7 days to build in CNSs. Is it my encouragement not to take these drugs? Absolutely not. My encouragement is to only take them when you need them. And in general, when you do take a drug, you should always ask yourself, am I using this as a tool to enhance myself? Or am I using this as a tool to diminish my side effects?